India is battling mass death at a record level, and the situation is increasingly dire. We know that the Indian Prime Minister Modi is in high-level meetings right now to address the crisis, as he should, because India just announced 332,000, over that number, 332,000 new cases of COVID-19 in the country. This is a new grim record, the world's highest daily rise in the number of new COVID-19 infections since the pandemic began. The deaths from coronavirus in India continues to spike, and experts say that the number is likely to be undercounted because of the nonstop cremations that are taking place across the country. The health system is in crisis, if not collapsing in certain areas of the country. We know that there are not enough beds. The Delhi health minister says that the city needs 5,000 more intensive care beds. There is not enough oxygen. At least 6 hospitals in Delhi have run out of oxygen. Doctors are telling patients to stay at home and to somehow find care there. And desperate people have resorted to social media and taken to Twitter to beg for much needed supplies like medicine, like oxygen, like ICU beds for their sick loved ones. I'm going to run through some examples of these tweets that are from verified accounts. These are media professionals that are not only covering the crisis, but they're trying to survive it as well. You know, this tweet is from a media commentator, Study Ghosh, who writes, "Looking for an oxygen concentrator, very urgent, location Delhi. Any leads, please help." The next tweet is from an editor saying, "Name Sandeep Verma, COVID positive, lung infection found as pneumonia, admitted at Metro Hospital, need plasma of any group." Nicola Karim, another journalist, writes, "SOS, please help my friend and colleague find a bed with ventilator for his cousin. His oxygen levels have dropped to 45. He's been waiting since 10 a.m. He is just 39 years old. DM, direct message if you can help." Now, earlier, Indian author and journalist based inside the country, Barka Dutt, spoke to CNN passionately about the situation there. She said, "This is a time of national crisis. This is a time of national mourning."
The health system has absolutely collapsed, and I use those words with full responsibility. And as a reporter who spent the last fortnight on the ground traveling across India, chronicling ICUs, cremation grounds, graveyards, and funeral sites, I do not believe that even now our political establishment has woken up to the enormity of what we're dealing with, because nothing else would explain the fact that election rallies in one of the eastern states of India are still ongoing, which means mass congregation.
Many across the country are blaming the government for the crisis, for allowing packed election rallies to take place, for allowing extremely massive religious ceremonies to take place with very little social distancing measures in place. We know that the government of the Prime Minister, Narendra Modi, earlier this year, or rather last year, when he ordered that harsh, extensive nationwide lockdown, he has been loath to do that this time around because of the economic cost involved. But it has led to this situation, this record number of new cases in the country, over 335,000 new cases of the coronavirus across India. It appears that the country has let its guard down, and the people are now paying the price. John.
In record numbers. Kristie, thank you. Kristie Stout live for us there in Hong Kong.